In the second section of our lecture, which is the tumors of the liver and the biliary tree, now we will talk about the cholangiocarcinoma. And in this section, we will mainly talk about what is the cholangiocarcinoma and then how the cholangiocarcinoma is diagnosed, different patients, how they present if they have cholangiocarcinoma, and what's the treatment options for the cholangiocarcinoma. So cholangiocarcinoma, this is the intrahepatic cholangiocarcinoma. Cholangiocarcinoma is the term mainly used for the biliary tree, biliary ducts, biliary tract. So all this is, we have intrahepatic biliary tree, we have extrahepatic biliary tree or biliary ducts. So intrahepatic are the which are inside the liver, extrahepatic which are outside the liver. And the main function of this biliary tract or biliary tree is the transport of the bile from the liver, gallbladder, through the pancreas into the duodenum. Duodenum is the first part of the small intestine, which is the C-shaped structure, and this opens into the duodenum where there is ampulla of the water where it is open and then release the bile into the small intestine where it performs the functions of its metabolism. So the biliary tree is the tree responsible for the transport of the bile. So we have intrahepatic and extrahepatic. Intrahepatic, here if you see, this is the intrahepatic cholangiocarcinoma. If you see, it's present inside the liver, not outside the liver. It's a mucin producing adenocarcinoma. So cholangiocarcinoma is the mucin producing adenocarcinomas. It's from the biliary tract or biliary tree. The cholangiocytes are the cells which are responsible for the cholangiocarcinoma, and then the differentiation of these cholangiocytes is tells us about the staging of the cholangiocarcinoma, about the prognosis of cholangiocarcinoma, whether it is poorly differentiated or it is well differentiated. So it's the differentiation of the cholangiocyte. Cyte is the cell, cholangio is for the biliary tract or biliary tree. Then this is again the intrahepatic cholangiocarcinoma. That's the gross appearance. It may be intrahepatic, perihilar or peripheral type of cholangiocarcinoma. Complicate primary biliary cirrhosis. So if there is primary biliary cirrhosis present, this type of cholangiocarcinoma, it complicates further the primary biliary cirrhosis. It's a Klatskin's tumor. Collapsed gallbladder is present if there is cholangiocarcinoma. Painless jaundice, pruritus, and there is weight loss also present. The jaundice and itching pruritus is very, very significant of the biliary tree disorder or biliary tract disorder. Whenever there is jaundice, which is the yellowish discoloration of the skin because of increased level of bilirubin in the body, and that jaundice is very, very commonly associated. People come and they complain of very bad pruritus or itching. They are very, very significant of the diseases of the biliary tract or biliary tree. There is also the weight loss of the patient. So these are some important features. The biliary carcinoma of the biliary tract or biliary tree, which is cholangiocarcinoma, it complicates if there is primary biliary cirrhosis is present, and then it may be intrahepatic in the liver, it may be perihilar or peripheral, it may be associated with jaundice, pruritus, and weight loss, and it can cause collapse of the gallbladder. So collapsed gallbladder is also present with the cholangiocarcinoma. The predisposing diseases that can lead to cholangiocarcinoma is primary sclerosing cholangitis. Cholangitis is inflammation of the biliary bile duct. So cholangitis, if there is sclerosing cholangitis or inflammation, it can cause cholangiocarcinoma. Then the other is if there are any autoimmune diseases, they can lead to cholangiocarcinoma. Chronic biliary inflammation and injury, if there is chronic biliary, same as the cholangitis, if there is biliary cholangitis or inflammation, and if there is injury to the biliary tract, it can also lead to cholangiocarcinoma. Alcoholic liver disease can lead to the cirrhosis of the liver, and then it can also lead to cholangiocarcinoma and cause damage the biliary tree also. Then we have choledocholithiasis and choledochal cysts. Choledocholithiasis, litho is for the stone and choledocho is for the gallbladder, bile ducts and biliary tree. So it's present any stone in the biliary tree or bile ducts, and also the cyst present can also lead to cholangiocarcinoma. And then finally we have a disease known as the Caroli's disease. It can also lead to cholangiocarcinoma. So these are some predisposing diseases. If they are present, they might lead to cholangiocarcinoma, and the presence of these disease, and if the symptoms indicate, signs indicate that there might be cholangiocarcinoma, then proper follow-up, proper diagnosis is important. So treatment should be started early in the stage. The diagnosis is the biopsy. As with any malignancy, the biopsy is the very important diagnostic step. Endoscopic ERCP. ERCP is endoscopic retrograde cholangiopancreatography. So this is one other diagnostic test. Then the staining is performed. Serologic tumor marker detection. So tumor marker detection, if they are elevated or not, like carcinoembryonic antigen, then we have CA19-9. All these are the tumor markers that can be detected. Ultrasound or magnetic resonance imaging. Then we have MRCP, like ERCP, which is endoscopic retrograde cholangiopancreatography. MRCP is magnetic resonance cholangiopancreatography. Graphy is the recording. So these are the recordings done in which we do look for both the biliary tree and the pancreas also. And then we have helical CT scans. So these are some diagnostic tests done for the cholangiocarcinoma or the tumors of the biliary tree or biliary duct. This is the microscopic appearance of the tumor, and then this is the gross picture. CEA, CA19-9 and CA125 are often elevated. That's one of the diagnostic steps to measure the level of the tumor markers, and they are elevated in the cholangiocarcinoma. And these are the three tumor markers that can be detected. Then we have positive for cytokeratin 7, 8, 19. That's another test, and negative for cytokeratin 20. So this is cholangiocarcinoma, positive for cytokeratin 7, 8, and 19, but the negative for 20. Treatment is the bile duct resection. So bile duct resection is performed. Lymphadenectomy, removal of the lymph nodes if they are involved or if the tumor is metastasized. So lymphadenectomy or the removal of lymph node is performed. Then we have pancreaticoduodenectomy. Ectomy is removal of pancreas and duodenum if is also performed. So these are all the localized regional areas of the biliary tract, biliary tree, and the removal of these is just in the effort to improve the survival and cure the tumor, regress the tumor. So we have bile duct resection, lymphadenectomy, pancreaticoduodenectomy. And also we do the post-operative radiotherapy is performed after the surgical procedures. Radiotherapy is performed. And there is also intraluminal brachyradiotherapy. So intraluminal, from the lumen, from the opening, the radiotherapy is performed. That's more effective. Photodynamic therapy is also performed. That's the very good picture. This is the liver. That's how the gallbladder is situated below the liver, and this hole is the biliary tract or the biliary duct. Carry the bile and then through the pancreas and then open into the duodenum and carry the bile with it. Photodynamic therapy, photo is for light, so the light therapy, transplantation, radiosensitizing therapy is another treatment option. Cisplatin plus gemcitabine is also used for cholangiocarcinoma. Hepatic arterial chemotherapy. So hepatic arterial chemotherapy is given. So that was all about our section 2. Thank you for watching sqadia.com.